Hi, I'm Dr. Sheikh. I'm a psychiatrist working at Chainama Hospital. This training on the suicide prevention was very appropriate to our clinical work. We, from time to time, have been seeing the patients who come to us with either ideation or suicidal attempts. So it is very good for us to help these people, and it's very relevant to our clinical settings. As far as the Celebrate Recovery program is concerned, I think it's very relevant in our settings because of the reason that the huge number of our patients, they come with alcohol and drugs related problems, and this is a program which can help them. So I highly recommend it. Thanks.
Hello, my name is Dr. Chioni Siwo. I'm a psychiatrist and I work here at Chainama Hills College Hospital, where I manage patients with psychiatric conditions. I teach medical students as well as nursing students and clinical officer students. I also do a bit of administration. I'm what you call a head clinical care. Basically does the operations of the hospital. I need to make sure that the doctor's available to see patients, there's food available for the patients, and there's drugs also available for the patients.
So my name is Maria Akani. I'm a psychiatrist. I'm also a clinical neuropsychologist, and I'm a Christian. So I enjoyed the ASSIST training because of my day-to-day practice. I see a lot of people, mostly after they have already attempted suicide, but also some of them still contemplating suicide. So it was quite good to be in this training and also to think about it in terms of my day-to-day life, because I think sometimes when you're thinking about it in terms of the clinical setting, there are certain questions that you would directly ask. But with the ASSIST training, we had to think about different situations that we live in and friends we meet outside when they're not necessarily identifying me as a psychiatrist, but as a friend, but then still being able to see those invitations and feel the courage to ask them about suicide without feeling like I'm invading in their lives or trying to be a doctor to everyone. And just this morning, it was good for me to think about it because my nanny lost her son, and she seemed low this morning, but it wasn't like I didn't think about asking her all these questions. So yeah, going back home to my own home and trying to use some of this to visit my community with the same approach. And then with the Celebrate Recovery program, I'm looking forward to it as well because, well, being a Christian, I really believe in the transforming power of Jesus Christ. And I believe in being able to help people beyond what we can do for them here. So aside from the fact that I'm a psychiatrist and I think alternative treatment is good, I'm also quite active with my church and with my community, and being able to acquire those skills and being able to show them some help that they can get other than what the world has to offer is something I'm really excited about. Thank you.
Hi, I'm Kangwa. I'm a psychiatry trainee, basically working in the psychiatry institution for the last 6 years. And so basically my work is just anything related to mental health. And I work directly, mostly in the wards, seeing patients in the wards. So I've had 2 days of this ASSIST workshop, and it's been really great because I think now it, for me, connects the dots to things that I probably learned and encountered before, but I think it gives me more confidence in what to say, because a lot of the times when people are talking about suicide, you kind of get stuck as to what are you supposed to say or how are you supposed to follow through. And also it puts a thought on how we're going to link these services to our communities and think of, for me, how as a hospital we can help or be the people that pioneer something that can help the community. So yeah, I think it's a great program, and even as far as, you know, not just being a doctor, but, you know, being a family member or, you know, being somebody in the church community. Those are the kind of communities that are close to me. And yeah, I think it's a very good workshop. I think more and more people need to do it. It's something, especially that it's something that doesn't need a physical presence. It's something that you can do over the phone. In a town or a country that's resource limited, I think, you know, we have various toll-free numbers available. So if we could be like an add-on and have this service, it will be great. So thank you very much for the workshop. It was brilliant, and yeah, thanks.
My name is Dr. Maira Brian. I'm a senior resident medical officer here at Chainama Hospital. My role here as a clinician is to provide on-point care to patients who come and ensure that they receive appropriate treatment. Well, having participated in the training assists applied suicide intervention skills training is actually a privilege which is rare and has been a very good thing, because it gives me a framework to be able to provide assessment for patients who might be potential to commit suicide. So my screening of patients with that regard is going to improve and even become better, because my alertness has just been increased, especially with the framework which has been introduced by the trainers, the pathway for assisting life, because it gives me a way of asking the questions in such a way that the patient will be able to open up and speak about suicide. I therefore recommend that this training can come forth even to extend to other parts of this country, Zambia, because by and large, I feel that this training is going to increase the alertness of the community with regard to suicide, such that prevention of suicide is going to take place in such a way that the people that are committing suicide in terms of numbers is going to reduce. And further on, for those that end up committing suicide, interventions under the post-vention therapy will be provided, such that assistance is going to be rendered to the victims that could have undergone injury and those that may have been affected. I therefore feel that ASSIST is a very good training that should come forth and be a part of an ongoing program that will involve the entire country, Zambia at large. Otherwise, I'm so thankful to have participated in this training. Thanks.
My name is Mwamba Nayame. I'm a mental health nurse working for Chainama, the biggest referral psychiatric hospital in Zambia. I can say I've enjoyed attending the ASSIST workshop. I think it has really helped me with the skills, especially with the PAL, that's the pathway for assisting in life. When you connect it with the safety framework, I think it really helps in dealing with psychiatric patients who's trying to commit suicide. Previously, I think there were some gaps in what I was doing. There were some gaps in how you explore invitations. By the way, invitations are things like the physical, the words, the feelings, the emotions. I think I overlooked that previously, but now I think when I'm dealing with a patient who is contemplating suicide, I'll be able to probably look at the invitations. That will help me and help the client as well. Then I think from the PAL, which is the pathway for assisting life, something like that, even that one will help me in that I'll be able to probably go stage by stage without really mixing or missing the sync. Generally, I'll say the workshop has been fruitful for me, and if others could go through the same training, it would really help the bigger community, because suicide starts from a community and then comes into the hospital. Sometimes they don't have a chance of coming into the hospital, they'll probably end up committing the suicide while at home. But if other community members can also go through the same training, I think it would really go a long way for us.
My name's Siangombe Isabel, enrolled nurse. I have a Bachelor of Arts in Library and Information Studies and Development Studies. Currently, I'm working as a nurse at the clinic. I'm also a psychosocial counselor. I've been very happy to have attended this training because I look at what I've done. That is my profession. As a development analyst, suicide has been something that has really taken most of people's lives. This is so because of poverty that we have in our country. Poverty has really taken most of our country, of our people. They've committed suicide, most of them. So out of this training, really, it has assisted me because I will help out in the community. Just like we learned that we help out in like finding resources, help them find resources on how they are going to end the poverty. And looking at the side of my profession as a nurse, we had a different way of handling cases of suicide, but out of this training, I'll look at it in a different perspective. We are going to treat our patients, we are going to take care of them, we are going to intervene from what we have learned, and I'll give them time to air out, to throw out their pain to me. I'll listen to them. That is what I've learned from this experience. And my wish is that this training will not just end here. We hope the whole training will go around the country, and I hope to be one of the participants in that trainer of trainers. Thank you.
My name is Lista Kaira. I'm a clinician at Chainama Hospital. It's a mental hospital. Trained by profession, I'm actually a clinical officer psychiatry, and then I also did some political science degree together with development studies and also international relations. So this training is actually very, very important to me as an individual because of what I went through. So I'm gonna give a scenario about what happened to me in relation to suicide. So it's a situation at my home where I lost my mother, I lost my own husband, and then these are great losses for me. So me, as I'm actually coming from a family of 5. I'm the second born, and as in ladies, I'm actually the first girl, a big girl in our family, and that is very important to our African societies. Now I've got a young sister, so now having lost mom, having lost my own husband, this has had and still has great impact on myself and also to my siblings. So the situation is I was really traumatized because my father actually brought in a woman in our house without mentioning it to us, and this woman was never kind to us. She was so bad, and whenever we explained to Daddy, for Daddy it was just a by the way thing, but then I was really being affected. So the thing is, for my young sister, she was really affected so much, whereby she could snap at every small thing. She could easily enter into confrontations with every member of our family because she wanted that attention, because she was so close to my mom, she was so close even to my husband. So she really wanted the attention. So the only place she could get attention was from my dad, and my dad's attention had moved to the new wife. So it was really bad for her. So I remember one day I just went to visit. So we just had like a confrontation over the bathroom. And then after quarreling like that, I went out for shopping, and then I just had a phone call that she actually had swallowed some tablets and she wanted to take her life. So that was, for me, my first reaction was like, she's being silly, she has to grow up, things change, and then she has got to look at life in a different way now, because I didn't know like different people react different ways to different situations. So I've learned that after this training, I actually have learned that actually somebody, even if they are contemplating suicide, suicide should not be contemplated. So somebody should be helped out of it. So actually, my own contributions to this is that this training and its impact to our societies is very important because many people in our societies have actually died because a lot of people, including health workers, all we know is just maybe we don't know how to really alleviate the causes of suicide, even just how to take this person out of their situations. We haven't known, but this training has helped us have the skill and the knowledge. And I wish it could be extended even to a lot of other people, like community leaders, the police, the teachers, even the clergy, because these people are the ones that are very close to the people out there. So if they knew how to handle a suicide situation, then it will really help decrease the number of people dying due to suicide. And then the other thing is that I appreciate that this training has been done to us here in Chainama. Now Chainama is one of the urban areas. Now it being an urban area, and then us, okay, we are few, we are here, but I wish it could have been extended also to the rural communities and also the shanty compound, because in our setups here in Africa, mostly people that are committing suicide are actually in the shanty compound and also in the rural compound because of their economic situations. So that is my own understanding to this. Thank you very much.